Welcome everybody. This is the Diversity, Equity, and Inclusion podcast with myself, Julia Grapsa, and Dr. Mirvat Alasnag. And today we have our guest, Dr. Ritu Thamman, Associate Professor of Medicine at University of Pittsburgh. She's a great friend of ours and a great colleague. We've worked together on multiple projects. She's also chair of Women in Echo under American Society of Echo. And within ACC, she has served as a task force for disparities of care since 2015. And Dr. Ritu Thamman is the founder of Pennsylvania chapter of Women in Cardiology section at the American College of Cardiology and a great advocate for women, as I said, a great colleague and a friend. Ritu, thank you so much for accepting to do this podcast with us. It's a great honor to have you.
Thank you so much to both of you, who I consider superstars in women in cardiology across the globe. And it's my privilege to know you both. So thank you so much.
You know, Ritu, I will start with something that was quite striking to us. You did a wonderful webinar on radiation and the radiation exposure for women. Immediately, I thought that a very good friend of mine from an Eastern European country who was a very dynamic interventional cardiologist. And during her pregnancy, she was going into the cath lab and she had severe complications with her pregnancy. Eventually, when she gave birth, she abandoned interventional cardiology and now she's doing a general cardiology practice. But you know, I spent many hours not only discussing the cost of radiation with her complications and, of course, for the impact that had to her health and also the health of her baby, but also the how supported she felt from her institution, and of course her way back after having a baby. Now we're going to first to discuss this topic: how important is to protect women in cardiology, especially women that they deal with the cath lab, either interventional cardiologists or structural imagers, and how important is an all-around consideration and institutional policies to protect women. Is this like far away to that we are practicing in a safe manner? What's your experience? What you've seen so far?
I think it's an excellent question, and it's a timely one because the number of procedures we as interventional echocardiographers or interventionalists are doing are exponentially increasing. We've seen it now, even with the TriClip, which has been approved by the FDA for over a year. And what we know is, one, we don't have a lot of information. There's not a lot of certainly published data. So the scant amount that we do have, we have to pay attention to. So we know what we should be looking for in the next steps ahead. What we know right now is that each procedure has a different dose depending on where the C-arm is. And for example, if we're doing a left atrial appendage occlusion and we have to use an RAO, like a steep RAO, we're going to get more radiation there. And if we're doing a TAVR, which mostly now we're just doing transthoracic, and a lot of we have sonographers doing them. But if they're going to be using a self-expanding valve, we know that in the cusp overview projection, that's an RAO view, and you're going to get more radiation. What was very interesting is that there's a huge range of what we consider necessary protection across the globe. And in the US, it varies substantially, just like all around the world. But there's different dosimeters that we have to wear. And the ideal one would be just like what the radiologists wear, which is an operational one, which is an active live dose monitor. So it tells you, hey, you're getting too much exposure or it starts to beat. And wouldn't it be great if we could have that on display? And so in every cath lab, you have, Ritu, you need to stand back in the room because you're getting too much exposure right now. And especially in those women who are pregnant, we don't really have any substantial evidence of what the doses. We're just estimating right now. And of course, we have to wear fetal monitor as well. And I know from just reports of interventionalists across the globe, they're not letting, or they're advising pregnant women who are doing triclips to really not go in because those cases are long. We don't have a lot of experience yet, so we're not really that good at it like we are with TAVR, say. It's much more straightforward. And so longer cases. So one of the things right now that somebody can do is one, uh, know that if it's going to be a steep RAO projection, stand back because distance is key. Number two, the things that are available right now in terms of protection, like putting something on the ceiling to reduce the scatter, it's too expensive. We're hoping that we women will also interact with industry to come up with more cost-effective solutions. Number three, you got to advocate from the point of a legal point of view, that if you are an employee, that there should be legal protections for your work environment, that they have a legal responsibility to protect you. And so that you are merely bringing that to the attention of the administration. And some things to advocate for are those active dosimeters. Yes, they're more expensive, but if they're willing to pay for it for the radiologists, well, why wouldn't they pay for it for us? We just have to sort of band together. I think some of the publications, I know Dr. Mirvat has also been actively a part of this and certainly gathering information from, parts of the world where there's no radiation guidance. There were people on this webinar that were saying they don't even have like a thyroid shield, or they don't have much more than a skirt to do the procedures. And that's the standard. So the standard is that there is no standard. And we coming together, are bringing this information out so that everyone that is doing these procedures can advocate and say, this should be the standard. And as we collect more and more data on it, I think it'll become easier, but that's what we are trying to do, especially with the active dosimeters.
So, Ritu, you've been a leading woman in prominent organizations and societies such as the American College of Cardiology and the American Society of Echocardiography. And we often hear a term, Queen Bee syndrome, about leading women and women in a powerful position. Could you just perhaps explain to us what this terminology means and how we should be overcoming it as a community?
That's an excellent question. Queen Bee has been marketed and really caught on in many, many publications and books. So what it means is the queen bee is the one powerful person or bee that controls all the other people, the little bees around her, and they do her bidding. But in reality, that is really not a win-win situation as human beings. We are all playing the game of life here. And so when you think about a field that is so competitive as cardiology is, you might think, well, I am working with a bunch of frenemies, and that's fine. It's still a game of life, right? It's still a game that you're playing, and you better know what the rules are. And the rules are, even if they were made by men, you still can play the game. It doesn't matter. So when you're in it, you have to understand that the rules are all about power and how you are able to gather power, keep it, and then share it. And when you look at people, men in particular, who've successfully played this game, they are not acting like queen bees. They are all in of themselves very powerful, but then they have formed these sort of tribes together. and they are, working together, one step at a time. And I think that that's probably one of the biggest lessons we can all learn. Like both of you here, you're younger than me. You're just superstars. And, it makes me so happy to think, okay, you can all progress and you could progress together in your own way. And it's much better for you to remain friends and to do it in a way that enhances both of you rather than only me. Only Ritu can be the queen bee. That just doesn't make sense. I mean, from even just a fundamental evolutionarily level, it does not make sense. What you all are doing and what I have learned over the years, I I'm married to a very successful white man, and over 30 years, I've learned how to play the game. And I see what he's done. So it works. Not an isolationist policy will not work in this at all. There's room for everyone, and that's the only way that we as women are going to be able to really expand our power is to know you can be brilliant, and so can Mirvat be brilliant, and it doesn't take away, but working together, you're going to bring more people into this tribe. It's going to help all of you.
That's very wise, Ritu, and thank you for saying that because I think we could help, women could help each other more. Now, I will take you a little bit to what we call the glass cliff. And practically, many women, they're being given leadership positions that though they're about to fall from the glass or from the cliff, meaning it's like a dangerous or ambiguous position, or to save, an organization. Do you think that, have you seen this happening? What would you advise a woman? Sometimes we are thinking to start saying no, then people say, oh, you need to be the good girl and accept everything that you're being given. Where is the tricks and paths of our lives? Like, what's your experience on this?
Well, the idea of cliff, I think, is a good one because it is a precarious situation, and it's sort of emblematic of the roles that women get within leadership, uh, that make it seem less desirable to a man because there are inherent problems with it, and they're obvious. And when you go back and you look at the DEI landscape, and you look at, certainly this term came from politics, and looking at the UK situation, or even our politics, and with choosing Kamala Harris, et cetera, there were precarious situations that no one expected the person to do well because it was, very difficult, and it was just almost like a sacrificial person. And then it's easy then to say, well, we gave the position to this DEI initiative, but they sucked at it because, well, the other underlying thing is, well, you didn't give them the same resources, say, that maybe the men would have. But again, if you're in that position where it's a failing job, say, but you've been offered it, you have to understand that in order for you to succeed at a job, whatever it might be in cardiology, you would need backing and you would need support. And so how men play the game is that they will, over time, be building their networks behind the scenes. Yeah, so if a situation were to come up, they would be much more sort of entrenched. They're already got, they know who is aligned with them politically. And I think women, you put your head down and you work hard and you just don't think of like sort of the political landscape that you're a part of. And it's just part and parcel of breathing air. You can't avoid it. And if you're able to navigate that and really, before anyone gives you the job, if you can have a glimpse at behind the scenes, like who's actually in the position of power, who controls the purse strings, who can actually help navigate tricky situations for you, because you're going to need the buy-in, and if without that, you're going to fail. And those are sort of the things that, when you think of a cliff, you don't necessarily appreciate. But that's not to say that you can't walk on a cliff, right? We have all done it, and you don't have to fall over, but you just have to know that I need to know the right resources behind, so I'm not going to fall over that cliff.
Ritu, I want to ask you, if you are approached by a younger colleague, man or woman, who wants to venture into an academic career, what kind of advice would you give them about work-life balance and quality of life, and how to go about it?
Well, first of all, the idea of balance, there is no such word that exists in cardiology. There is no balance. All of us are very passionate, driven people, and we want it all. And I think that you can have it all, but you're going to have to have it with caveats, and you're going to have it at different times. Now, for example, when I was younger and I was raising a family, I wasn't going to meetings. You just can't do all of that. You're just trying to stay afloat. But as your kids get bigger, and you don't need to be there all the time. And also, they need to see strong role models, which you are, right? With your children, they see, and that is actually a huge influence on their lives, probably more than anything else. But in terms of the balance, you pay for as much help as you can afford. And you think, well, I'm just not saving enough, or I'm not whatever. But that really is the most important thing. If you're successful, you're going to have opportunities down the road. It's a long career, and that doesn't stop at the age of 65. It goes beyond that. So pay for that. If you are lucky enough to have family support around, of course, that's the ultimate. Not everyone has that, but for everything that doesn't require your substantial brain power, um, get help. I mean, that's what's available. And I think, for writing grants, for writing manuscripts, and for, just taking care of routine family business, because it is a business that you got to run, outsource as much as you can. And then, you're different periods of your life that you'll be focused on one thing or another. And I think up front, when someone's just getting into the academic realm, focus on being the best clinically that you possibly can. Because not only does that give you sort of credibility, in the hospital or in your division, but it also then allows you to think deeper into, what are the gaps here? Where there's so many gaps in cardiology, like, but you have to be able to, like, the more you know, the more you're more deeply able to think about it, and then come up with something that will that you want to answer, that you want to delve into further. So I think that would be my first approach, after like hiring as much help as you possibly can up front. And don't worry about necessarily the financial piece as much up front, because if you're, like I said, if you're successful, that will follow. There'll be other opportunities for you down the road, and you'll be able to earn enough. And I think academics, the way they are now, you definitely have to have some kind of niche. Dr. Grapsa is my person for tricuspid. Dr. Mirvat is my person for interventionalists that are high risk bifurcations, imaging, and so everyone has this sort of deep knowledge, and that's what we absolutely need to succeed in academics, along with the politics.
Excellent. And Ritu, could you name a mentor that really changed your life?
I would say my greatest mentor was Mike Weisfeld. He was the chair of medicine when I was at Columbia, and he was a incredibly gracious and prolific mentor, not only to me as a female. He has 3 daughters, and so he really very well understood what that was like, life as having with daughters. But he also, taught that mentorship extends beyond just this gender. And he helped so many people, including myself, like Josh Beckman and Matt Maher, people who are all of the same group of people that were at Columbia at that time. So I was fortunate to be at the right place at the right time.
Before we wrap up, Ritu, you've had quite an expansive career. What is the one piece of advice that you got that really resonated with you until now?
I think the best advice that I got is everything changes. There's the minute you get comfortable, you think, oh, this is the way it's going to be. No, things can change in a heartbeat, literally. And I've experienced that. So I think one of the caveats from that is, learn to live in the moment in a detached way. This is sort of fundamental. Because you know that in this moment, I'm going to be happy no matter what, because that's going to be my grounding principle. But it will change. Whatever it is right now, tomorrow is not going to look like this, even in the most subtle ways. And just keep that in mind. So even if you're encountering a bad situation or a good situation, whatever, it's either way, they're transient. So you're going to get through it. We all do.
That's great advice. Mirvat, shall I let you close this podcast?
Well, thank you both, Julia and Ritu. This has been really heartwarming to listen to. A lot of advice to our younger generations, a lot of advice to women, and also helps us all reflect back on our own careers and our own mentors and advice that we got. So just to our audience, stay tuned. We have another episode coming around the corner, hopefully to shed more light on diversity, equity, and inclusion.